Happy National Public Health Week and welcome to our kickoff forum, Center and Celebrating Cultures in Health. My name is Susan Poland and I'm the Associate Executive Director of Public Affairs and Advocacy at the American Public Health Association. A couple of just quick background notes. Closed captioning is available for this webinar by clicking CC at the bottom of the player. This webinar is also being translated into Spanish. You can find the link to the Spanish translation in the description of this event and also in the chat. Please use the chat feature to introduce yourself, share your thoughts, and ask questions during the event. We want to know who you are, and we want to hear from you. You can add your questions as they come in, but we'll take the questions towards the end of the presentation. Today's webinar will be recorded and posted to APHA Now, which is our digital library of events, CE offerings, and more. Today's event is being held during National Public Health Week. During the first full week of April each year, APHA brings together communities across the United States to observe National Public Health Week as a time to recognize and celebrate the contributions of public health and highlight issues that are important to improving our nation's health. I hope you will join many of the other events taking place this week, hosted by APHA and our partners, and you can find out all that information on the website, www.nphw.org. Let me begin with a land acknowledgement. We are gathered virtually today on the traditional land of the first peoples of the District of Columbia, the Piscataway, who inhabited the region between the Potomac and the Anacostia rivers. They were the original inhabitants for thousands of years. We honor their history and would like to express our gratitude to the land which has provided us with its bounty. Now let's really get started. It's my pleasure to introduce today's moderator, Dr. Chris Chenesalkit, the current president of APHA. Chris is a longtime APHA leader and is grounded in a strong belief in eliminating the structural barriers to equity for marginalized populations. She holds leadership positions with local, state, regional, and national governance and civic engagement organizations working to promote racial, gender, and health equity. She served as the gubernatorial appointee to the Massachusetts Asian American Commission and the Commission on the Status of Women, where she advocated for the needs of Asian American women and women throughout the Commonwealth. She serves on the Planned Parenthood League of Massachusetts Board of Directors and as an adjunct faculty member at Temple University. Chris earned a BA in Biology and Art History from Boston University, along with an MPH from the School of Public Health at BU, and a PhD in Political Science from Northeastern University. In addition to her advocacy and scholarly pursuits, Chris is an elected library trustee of the Public Libraries of Brookline, Massachusetts, a Brookline Town Meeting member, a Brookline Community Emergency Response Team member, a Brookline Medical Reserves Corps member, and a Brookline Community Foundation Board member. Chris lives in Brookline with her husband, their 3 children, and their 2 puppies. As you can tell, Chris is one of our most busy and most productive members, and it is more than my pleasure to turn it over to you. Chris, take it away.
Thank you so much, Susan. And thank you, everyone. Hello and welcome again to APHA's National Public Health Week Kickoff Forum. I'll be your moderator for the event. And again, today's forum theme and this year's National Public Health theme are one and the same: centering and celebrating cultures in health. We're looking at how communities and our cultures shape our health, and we're celebrating all of our unique cultures and backgrounds. No one is an island, and there's so much to learn from each other because we all have a part to play in public health. And that is a great introduction to this year's National Public Health Week keynote speaker, Leah Thomas. Leah Thomas is founder of Intersectional Environmentalist and author of the Intersectional Environmentalist: How to Dismantle Systems of Repression to Protect People and Planet. Leah Thomas is a celebrated environmentalist based in Los Angeles, California, coining the term eco-communicator to best describe her style of environmental activism. Leah uses her passion for writing and in creativity to explore and advocate for the critical yet often overlooked relationship between social justice and environmentalism. With this intersection in mind, Leah founded and launched the nonprofit Intersectional Environmentalist, a platform and a resource hub that aims to advocate for environmental justice, provide educational resources surrounding intersectional environmentalism, and promote inclusivity and accessibility within environmental education and movements. Building on her work in the field, Leah penned The Intersectional Environmentalist: How to Dismantle Systems of Oppression to Protect People and Planet. It's published in March 2022. And the book serves as an introduction to the intersection between environmentalism, racism, and privilege, and as an acknowledgement of the fundamental truth that we cannot save the planet without protecting all of its people. Leah is also the founder of the eco lifestyle blog at Green Girl Leah, where she uses her multiple years of eco-focused educational and work experience to inform her ever-expanding list of projects and connect with her audience of more than 400,000 followers across channels. Leah has been named to notable lists, including Time 100, Next, Insider's Climate Action 30, Marie Claire's Creators to Watch, Ebony Power 100, and InStyle's The Badass 50. And she is an established public speaker who has presented at Google, 1% for the Planet's Global Summit, Dreamforce, and more. Her writing has appeared in a variety of publications, including Globe, Elle, Marie Claire, Teen Vogue, The Washington Post, and High Snobiety. She has also been featured in Harper's Bazaar, W Magazine, and CNN, as well as Good Morning America, ABC News, NBC, The Weather Channel, and numerous podcasts. Leah is a graduate of Chapman University with a BS in Environmental Science and Policy and a cluster in Comparative World Religions. She has interned with the National Park Service and has worked at leading green companies, including the eco-friendly soap company Ecos and outdoor retailer Patagonia. Wow, I'm excited. Can't wait to see it. Take it over, Leah, and thank you for being our keynote.
And that was so sweet. And sorry that bio was ungodly long. I definitely need to slim that up. But yeah, I'm just so excited to be here and talk about why I'm so passionate about environmental justice and some of the work that I'm doing with my largely Gen Z team that kind of intersects, well, very much intersects with public health. So just some background, as was mentioned in my bio, I studied environmental science and policy when I was in undergrad, and I also grew up in St. Louis, Missouri, in a small town of Florissant, Missouri, which for reference is about 10 minutes away from Ferguson, Missouri. And while I was studying environmental science and policy all the way off in California, there was kind of a start of a racial justice movement that was happening in Ferguson, which we now know as the Black Lives Matter movement. But because there was so much social unrest that was going on back home in St. Louis, I really wanted to find ways to use my environmental science degree and find the intersections with social justice that were also happening at the same time. Because I really wanted to help out in St. Louis and other primarily Black communities like my own, and really focus my environmental science degree on the intersections of racial and social justice. So I didn't really know where to start when I was in school. I was going to a school with not a lot of people that looked like me. I was in Orange County, California, which was very different from my time in St. Louis, Missouri. But when I began studying environmental science, I was learning a lot about the Clean Water Act and the Clean Air Act and all of this environmental legislation. But what I wasn't learning about in my classroom was the concept of environmental justice. So that's something that I had to do outside of my environmental science degree and kind of customize my studies to make sure I was learning about racial justice at the same time. And this is an issue that's happening in a lot of universities around the country, but thankfully it's changing. But environmental justice is kind of seen as this optional add-on to traditional sustainability studies, when really it should flow through the way we practice environmentalism, because racial justice, as many of you all know, is the number one indicator in many instances, racial inequality and also wealth inequality of who will experience environmental hazards and burdens, including things like air pollution, exposure to toxic waste, and things like that. So when I was in my studies and I was learning through my independent studies how big of a deal environmental justice was, I kind of wanted to scream it at the top of my lungs, because I couldn't think of anything more pressing than basic environmental human rights that I believe everyone should have: access to clean air and access to clean water, and that shouldn't be controversial at all. But because I wasn't learning it in my classroom settings, I decided to take to social media to try to find community, to learn about more people out there who also really cared about environmental justice. So fast forward a couple years, that's when I started Intersectional Environmentalist. And that was during the summer of 2020, because I really wanted to find a way for environmental justice to be as accessible as possible. I know I've said that word so many times, but there might even be folks in the audience who aren't familiar with it. And essentially, environmental justice is what I mentioned earlier, really trying to ensure that everyone, regardless of race and income, has access to a safe and healthy living environment. And during the environmental justice movement of the 80s that followed the civil rights movement and the Earth Day movement, researchers like Dr. Robert Bullard, who's kind of called the father of environmental justice, started to discover how race and income, unfortunately, and formerly redlined neighborhoods were the most at risk for environmental hazards and toxins and air pollution. And that has so many intersections with healthcare, causing respiratory illnesses, or even an increase in heat-related illnesses or heat stroke because of the lack of access to shade and tree coverage. So we'll fast forward to when I was doing my studies and was finding all of these things, and I was just really struggling to understand why, in even really prominent environmental spaces, people weren't advocating to make sure things like environmental racism weren't still happening. And not only that, a lot of my professional peers didn't really know about the data about how around 70% of African Americans in the United States live in counties that frequently violate federal air quality standards. And that's having tremendous health impacts on Black and Brown folks all over the country. So I wanted to do everything I could to raise awareness about that, and just brought it to the world of social media. And I wanted to find ways to break down this climate science and environmental justice information and make it as accessible as possible. And not only that, identify the grassroots, BIPOC-led environmental justice groups and hyperlocal communities all around the country that are doing work to make sure that everyone has access to clean air and water. And what I didn't know is that hundreds of thousands of people around the world, particularly Gen Zers, were really interested in learning about environmental justice. So much so that they were using some of the resources that we were creating and going to their teachers and telling them, why aren't we learning about environmental justice? This is something we need to know about, and it's something that we really want to take action on. So from then, or since then, I've just been doing my best to try to create really accessible resources, everything from a textbook that's being used in K through 12 education and in some universities. That's an intro to environmental science, all just with the goal of making sure that the advocacy for racial justice, for, income equality and things like that, health equality, are all interwoven in the advocacy of our planet, because it's my belief, and I'm sure so many of yours, that we can't really separate the advocacy of the planet from the advocacy of people. When environmental hazards are unfortunately impacting communities of color and low-income communities the most, with everything from fracking fluid to unclean air and unclean water. And unfortunately, the climate crisis poses an even bigger threat to that, because the communities that are the least responsible for the climate crisis are experiencing the highest burdens of it. And that's something that we have a better shot at saving our future if we can act now in the present and ensure that everyone has access to their basic human environmental needs and environmental justice. So I know that we have a really lovely panel that's going to be even more exciting, but I wanted to kind of give a preview as to some of the work that I'm doing right now. And I'm especially doing it because I want to make sure that environmental education is, one, as diverse as possible, because as a Black environmental science student, I didn't see a lot of people that looked like me until I went onto social media and I started learning about all of these Black and brown heroes in the environmental space that have been there all along. So I want young kids, regardless of their race or income or cultural background, to be able to look at environmental science and say, I can be a part of this field. And I also want to make sure that people have a really good understanding about the environmental justice issues that are impacting their community, and that they get connected with local grassroots groups that are doing amazing work. Because unfortunately, environmental justice funding, especially Black and brown-led organizations, receive less than 5% of philanthropic funding in the environmental space. So even though so many of these organizations already have the solutions to so many of the issues that are happening in their own communities, they just need the resources, the support, and the amplification in order to scale those efforts. And I think if we can raise awareness about the good work that they're doing, we'll be able to transform communities locally. And then that local action will extend to state action. That will turn into federal policy changes, which we're already seeing for the first time ever, having one of the first White House Environmental Justice Advisory Councils, for the first time having over $100 million in federal funding and grants specifically for environmental justice. And if we keep up the momentum, I really believe we're going to have an Earth Day 2.0 or an environmental justice renaissance that's intersectional in nature and is showing people why environmental issues intersect with things like health, education, racial justice, and so on. So that's a little bit about the work that I do, and I'm really excited to get into the panel.
Thank you so much, Leah. So as you can see, my introduction was not even as, it was just as it should be, because she's just as awesome as she is with the work that she's doing and the movement that she's making for environmental justice. So now I'm also excited to continue to have Leah here. She's going to be staying on with us for this amazing forum panel. We're going to have a discussion on centering and celebrating cultures in health. But I wanted to introduce our panelists first. So everyone get ready. First is Angel Charlie, is a highly accomplished Indigenous leader who has dedicated her career to addressing violence against Native women and girls. She currently serves as the executive director of the Coalition to Stop Violence Against Native Women, where she's demonstrated a deep commitment to building values-driven solutions that can inform system transformation around gender-based violence. As a citizen of the Pueblo of Laguna and Navajo Nation, Ms. Charlie brings a unique perspective to her work that is informed by Indigenous knowledge systems and values. She is deeply committed to advancing Indigenous power building and affirming Indigenous knowledge systems within the movement to end gender-based violence. In addition to her expertise and dedication, Ms. Charlie was appointed to the New Mexico Murdered and Missing Indigenous Relatives Task Force in 2019. She has been recognized by the New Mexico State Senate for her tireless advocacy and work to bring awareness to the movement. Ms. Charlie's commitment to social justice and gender equity has led her to her appointment to the 2022 White House Gender Policy Trilateral Work Group to address violence against Indigenous women. Her testimony at Congress was crucial in highlighting the urgent need for systemic change and accountability in addressing gender-based violence against Native women and girls. Additionally, Ms. Charlie is a highly regarded member of several boards and organizations that work towards ending gender-based violence and advancing social justice. And she serves on the board of directors of the Albuquerque Sexual Assault Nurse Examiners Collaborative, the Alliance of Tribal Coalitions to End Violence, and the Laguna Federation of Democratic Women. Ms. Charlie is a graduate of the University of Hawaii, where she earned a degree in communication. And next, we will also have on our esteemed panel, Felix Hernandez. Felix is a person committed to practicing strength-based, trauma-informed support to families navigating parenthood. Born in Houston and raised in Prince George's County, Maryland, Felix studied education and literature in Baltimore. He's been an educator in Washington, D.C. for children as young as 3 and in Alexandria, Virginia for students in middle school. His work in home visiting has transformed his understanding on the importance of protective factors that shield children from abuse and neglect. He continued learning about the long-term health implications of adverse childhood experiences, how it magnifies his efforts to tackle root causes of trauma in families and communities. Currently, as advocacy and fatherhood supervisor at Mary's Center, he engages families, family support workers, and professionals in early childhood education in the district to advocate for their well-being to city officials. Felix's primary mission is to challenge versions of masculinity and power dynamics that cause harm and trauma to others and the land. He works towards the society where conflict is constructive and benevolent at every level. He commits to supporting families and communities interested in creating the sustainable and healthy environment they want to thrive in. And then we will also have Dr. Diane Horvath. She's the co-founder and medical director of Partners in Abortion Care, an all-trimester abortion clinic in College Park, Maryland. She is passionate about dismantling the stigma that surrounds abortion later in pregnancy, providing care based on anti-oppression principles and training clinicians to view advocacy as part of their obligation to patients and colleagues and as a tool for environment. She's a lifelong Midwesterner before relocating to the Baltimore, D.C. area. She earned degrees from the Ohio State University, the Medical University of Ohio, and the University of Minnesota. After 4 years of general OBGYN practice, she completed a fellowship in complex family planning at MedStar Washington Hospital Center in D.C., a master's degree in public health at Johns Hopkins, and a year-long fellowship in reproductive health policy advocacy with Physicians for Reproductive Health. She has written and spoken extensively about abortion provider safety and her own experiences with anti-abortion harassment and violence. Her legal challenge to a former employer's restrictive policy on abortion advocacy was featured in multiple media outlets, including the Washington Post and the New York Times. And then last but not least, on this incredible panel of rock stars, we have Lupita Vasquez-Reyes. Lupita is a native of the Immokalee, Florida, where immigrant farm laborers provide 2/3 of the nation's winter crops, yet suffer the irony of food insecurity in a USDA-described food desert. She sees this, rightly so, as a form of continued violence and threat to the diverse identities that comprise her hometown. Lupita is a community activist, Platika healer, and cultural worker. As the daughter of immigrant farm workers who were organized in the early days of immigrant farm labor movements in Southwest Florida, Lupita uses her background to inform and radicalize change in her community through her efforts to collect the local knowledge of ancestral growing practices and helping to facilitate spaces that nurture healing, collective and collective approaches to care. Her heart work centers a return to ancestral knowledge and stewardship of food ways, language, identity, and comunidad in the garden, specifically among farm workers, communities, and youth. She is the community gardens and outreach manager for Cultivate Abundance. Wow. Okay. So I know that was a lot, but this panelist is just chock full of experience and everything that I could hope for in a National Public Health Week forum. So thank you. Welcome. We'll be getting some questions from the audience, but just to get us going, I wanted to start off with one question. I'll direct it to Leah, and then we'll pass it on to Angel, Felix, Diane, and Lapita. So the first question is, and folks watching along live, please use the YouTube question and comment tools to ask questions. We'll also have an audience, Q&A and all this. So let's go. My question, Leah, is this year's National Public Health Week theme is centering and celebrating cultures in health. How has your culture shaped your outlook and your approach to your work? We'll have Leah go first.
Yeah, this is a great question. I think one would be, I feel like my ancestors were definitely environmentalists. They just didn't really use that terminology, but I feel like I came to a lot of sustainable practices, even just my grandmother, like reusing her plastic bags or her butter container or whatever it was. So there are little moments like that when I look to the way that my grandmothers tended to their gardens, the ways that they were creating healthy spaces and safe, communities and outdoor joy moments, even if it looked a little different than summiting a mountain and may have looked like sitting on a patio. But I feel like kind of reclaiming how all of those things that are a part of my cultural values are also sustainable, even if, mainstream media doesn't always showcase our stories. It made me really happy to start realizing that a lot of Black and Indigenous communities and communities of color, sustainability kind of is our way of life. So by coming to this work, I'm just kind of reclaiming those practices, and I try to carry that with me through everything that I do. And then also because, Black and Indigenous communities do unfortunately bear the brunt of environmental injustice right now. I always come to this work with a lens of racial justice and equity, just to make sure that the communities that are impacted the most are able to get the most care.
Thank you so much. I love that you said all the way back to your grandmother reusing bags, and I feel the same way. So Angel, how has your culture affected your work?
Yeah, Chris, thank you. Also, just your introduction and your energy, I'm like, I want to be introduced by Chris all the time for everything. So thank you for that.
I'm going to be your hype woman. You all rock, right?
I'm feeling the energy. Thank you. Guatsi Haupa, everybody. Yeah, so I'm actually zooming in today from Acoma Pueblo, which is the community that my husband is from, but it's right next door to the community that I was raised in. And so growing up, where our origin stories are from, growing up and being able to be in ceremony in the places of my ancestors has really shaped the way that that I approach the work that we do. So we're a survivor-led organization, and we're from the communities that we serve. And so we have this belief within our organization that the solutions to violence exist within the communities themselves already. And so working to support the solutions that are happening already, right? Our communities have known how to keep themselves safe since time immemorial. And so it's just remembering those practices, really leaning into that we belong, especially as Indigenous people, to decolonial systems. And those memories are there, and we just have to tap into them from time to time. And I also think a lot of Indigenous communities are matrilineal. And so I come from a family where the women are in charge. Our clans are passed down through our mothers, our big clans, at least in my community. And so remembering the sacredness of women, especially in the work that we do, has been an important aspect to the way I approach the work. And then I think the last thing I would mention is just the interconnectedness of all things. And so I really appreciated the way that Leah opened us up, because these things are all connected. And those were just teachings from our early childhood, right? That everything has a life and everything deserves respect and honoring, from the land, the trees, the air, the water, to animals and all of the creatures on this earth, right, are our siblings, are our relatives in one way, shape, or form. So yeah, thanks, Chris.
Thank you. And then after having introduced Felix and his great work in challenging masculinity as part of your mission, please share with us how all of this, in your culture has shaped your work and your mission in the work that you do.
Thank you so much. I think that the first thing I can speak on is growing up as a child to an El Salvadorian mother and father, and also growing in proximity to other Spanish-speaking communities. It's very easy for a person to grow up as a young male, to grow up in a culture of what's called machismo. In the Spanish-speaking world, machismo is the word, in many ways, the catch-all term for patriarchy, potentially, right? It just describes the cultural practices that position men to behave in a particular way. And so growing up in a culture that was very much machista, I didn't recognize until, I did, that some of those elements weren't things that it's not how you build a bridge, and not a healthy one. And so now that I came to my realizations when I did, and have since been trying to interrogate and interrupt typical patriarchal power dynamics, mostly because I've seen the negative impacts it has on families, children. And so I think it also, the parenting dynamic for fathers looks a very particular way. And it's also really interesting now to find myself. I'm not a father myself, but I run a program geared towards supporting fathers as a means for, reducing child abuse and neglect, increasing protective factors. Being in this space as a person who grew up in what I would describe as like particularly violent environment, and especially violent towards children. It's just like, now, how do we show up in this space to interrupt those notions that we might be carrying from colonization, notions we might be carrying from patriarchy that are tied to religious practices that are, not indigenous to these lands. And so I feel like, because I became aware of where I come from, it means a lot more to try and figure out how we can bring more men in to reflect on the things that they might be carrying and holding on to that no longer serve their community or loved ones, in a way that ultimately means, it doesn't serve you to have a healthy dynamic if you're going to be only a disciplinarian, only a provider. You lose out on the potential of nurturing your child as a father if you only see your role as a father as a disciplinarian. And so I think that because I come from a culture that is very easily, indoctrinates, children into these practices, then interrogating first, and then interrupting, is something that I really try to invite others to do alongside, because this isn't something that, I haven't gotten here by myself. I'm standing on the shoulders of giants. I think that still remains to be true on all of us intending to carry on the torch of knowledge, compassion, and grace. And so I think that that's where I'll leave it. Thank you.
Thank you so much. I love what you said about interrogate and interrupt, and how your upbringing directly affects the work and the outreach that you do now on a day-to-day basis. So similarly, Diane Horvath, I'd love to hear how your culture affects your work and your mission, especially as you're doing the hard work today also of reproductive rights and, destigmatizing abortion in the political climate that we have going on. Where did all this come from? Why do you do what you do?
So I was raised in a pretty close-knit Midwestern community where everybody knew everybody and everybody was sometimes in each other's business, but when something bad happened, people rallied around their neighbors and their friends, and it wasn't even a question that you would be supported by the people around you when you had a crisis or when you were in need. I was also raised in the Catholic Church, and while I am not a religious person anymore, some of the Catholic social teaching has really stuck with me. And I think one of the things that I took from it was, if you see a need and you recognize that you have the skills to help meet that need and you don't do it, then who will? And so I always felt like building community for me was about existing in the community that we're in and building relationships. When we started this clinic in College Park, we were really intentional about reaching out to the folks around us, and we're very close to the University of Maryland. And so that meant the students, that meant our neighbors in our neighborhood, the other people in our complex, city leaders, community leaders, because we knew that we would not survive in that area if we didn't have community support and if we didn't become a member of the community in a meaningful way. And so, I think that culturally, I think I think a lot of it is a Midwestern thing. I don't know, people are always bringing over casseroles and stuff, but I think that's really extended into the way that we've built this clinic. Because right now, everybody on this call knows that the landscape around abortion access is really bleak. And fortunately in Maryland, we are supported by good laws. We're hopefully going to pass a constitutional amendment to enshrine abortion rights in our state constitution. But a lot of that didn't happen without the on-the-ground community building and the trust that the people around you are doing the best thing for themselves and the people that they care for.
Thank you so much. I love how you said, I'm from the Midwest and casserole, maybe that signifies kind of how you got started in this. So similarly, Lupita, we introduced you and talked about all the great work and, kind of hinted, of course, at the fact that it's your background that leads you to be the community activist, the cultural worker that you are. But please feel free, share with us, is there that one moment, did something happen that in your childhood or background that said, this is what I'm doing, this is where I need to be?
Oh, can you hear me?
Yeah.
Okay, great. I think when I was listening to everybody, Felix, Angel, Leah, Diane, thinking of sort of common themes and, of this space, and what brings us together is this richness in valuing relationships. But I think with culture and also interrupting spaces or interrogating spaces, I love that, Felix, but this idea of culture and how it, the culture we embody and the culture that brings us forward as humans and as people is really important. I came from two parents who were from the Central Valley in Mexico, the land we know as Mexico. We are our indigenous roots are Otomi, that are prevalent in that Central Valley of Mexico. But my parents came here to the United States. They crossed this border to work as agricultural workers. They were laborers, and they ended up in Florida, Immokalee, Florida, South Florida, because like so many that arrived here and that continue to arrive here, there was work. There was field work, picking tomatoes and other wintertime vegetables in Immokalee and in the surrounding areas. And so I was born here, my two brothers and I, and in the 70s, 44, and we're all 4 years apart. I have an older brother and a younger brother. And culture for us, I think we knew ourselves as, Mexicans and Mexican Americans, but my father never, we never had the Mexican flag hanging up in our house. We often talked about land and place as something that's embodied and something that is tied to the relationship we have with the environment, and also our relationship with the space that we're in. So in our case, our home and what we were growing on it and what we were sort of stewarding in terms of water collection or just plants and things that we were growing here. But you know, my parents would have a lot of discussions about the politics in Mexico, and also about the Spaniards and the conquista and the colonization that's happened, and the ideas of mestizaje, and, you know, carrying Spanish blood, and the loss, sort of the cultural amnesia that happens because of all that trauma, and also in trying to assimilate. And I think it's always been this idea of like identity, and where do I hold, what identities do I hold, both living here on this side of the United States, and then my family's lineages and ancestral lineages in Mexico. And I think when the work that I'm doing in the garden and in the community and stepping up into roles of activism really have to do with visibility, and really have to do with looking at folks' ability to be seen in a community, and to embody who they are and what knowledges they carry. That's both been healing for me, and a continued journey. So I think when we're looking at how do I approach my work, is always around this idea of care and identity and visibility for folks, and getting to the truth of, you know, who we are and where we come from, and how those things are important in order to carry us forward, and also to care for each other.
Thank you so much, Lupita. And I love how you said, and how do we care for each other? Because I guess I just want to lift up that each of these panelists and our keynote speaker is doing really hard work during a time that can be very polarized. And I think sometimes we in our work don't often prioritize our own care, right? You can't help others unless, you know, you're okay. It's sort of like that airplane, you know, put the oxygen mask on yourself first before you can help others. So thank you also for lifting that up too in your work. But of course you would, because you are also a healer. So, you know, we're also getting questions from the audience as well. So if it's okay, I'm going to just sort of sprinkle it all in. You're all, I'm the moderator. Goodness gracious for you. I get to just freewheel this. So my next question I want to pose, someone, you know, specifically had said, hey, Leah, I'd like to know, but feel free for anyone else as well to chime in. You know, what do you see, Leah, as the biggest challenges to reach better sustainable communities? And everyone else kind of, you keep thinking like, what's your biggest challenge?
This is a good question, and it definitely depends on the community. Like rural communities might face certain environmental justice issues, and urban communities. But just for some context, I think some of the really pressing issues that I see come up a lot could be food insecurity and food scarcity. So whether we're talking about rural Indigenous communities in Alaska or rural communities across the United States, unfortunately, we're seeing healthier produce being sometimes being 3 times the amount or 4 times the amount that it should be. And in a lot of urban Black and brown communities, we're also seeing more fast food restaurants and not a lot of access to healthy organic produce. And this has several different issues. One, it's really important to support local farmers and local economies. And it's kind of difficult to do that when fresh produce isn't coming into the communities that aren't too, you know, far away from them. And 2, there's so many health impacts that are connected with not having access to fresh, organic, healthy produce. Some other issues that I'm seeing are infrastructure issues, which are some of the hardest to tackle, because formerly redlined communities, and I know technically redlining is an illegal practice, but housing discrimination, even though it's illegal, still happens. So we're seeing formerly redlined communities or historic BIPOC communities where folks should be able to stay connected to culture and not have to move outside of their neighborhood to have access to clean air and water. But because of that infrastructure and housing discrimination that happened years ago, we're seeing Black and Latina and Indigenous communities that are kind of surrounded in something called a toxic donut. So there's more highways in our neighborhoods that are causing pollution, more toxic waste sites and landfills. And this is leading to a pollution burden that our communities are facing, that we're actually breathing in more pollution than we cause on average. So I would say those infrastructure issues, and then lack of access to healthy food and also safe drinking water, unfortunately, is an issue that's happening across the United States and urban areas, on reservations, etc. Just not having access to safe drinking water. And if you don't have access to these basic human rights, like, how can you experience joy? And it's such a miracle to me that so many communities of color, we do what we can to make sure that we're still experiencing joy, showing up, but joy and survival shouldn't be that hard to come by.
Thank you. Yes, I was muted. Of course, we have to do it once during a Zoom, right? Where I talk when we're muted. Someone has to do it. It was me. So, thank you for talking about, raising up food insecurity, infrastructure, and unfortunately still today here in the United States, lack of access to clean water. Angel, I want to turn to you. What is one of the biggest challenges that you're finding in reaching, your communities?
So our organization, I should start off by saying, doesn't provide direct service, but we're working with organizations that do provide direct service. And if anyone has been to New Mexico, you know that it's a land of land, right? Like, there's more land than there are people. And so the ruralness of our communities and the isolated, insulated nature of many of our tribal communities creates a lot of barriers and challenges for accessing the things that the communities need to thrive. So we have some tribal communities where it might take up to 3 hours for a police to respond to a domestic violence call in the community. Right now in the state of New Mexico, there's no sexual assault services based in tribal community, so that all has to be outsourced to local municipalities or border towns, which has its own set of complications and challenges for local community. And then there's, when we're talking about especially things like the murdered and missing Indigenous peoples crisis, we're navigating multiple jurisdictions and governments as Indigenous peoples. So we have tribal, state, and federal systems to navigate for pretty much any issue that we intersect with. But let's take protective orders, for instance. I actually was helping with a protective order a couple of weeks ago, and because of where we're located, when I went to the police station, I needed to know what were the people from the land grant community, because that would be county. Then I needed to go to grants to do that. Are they from Laguna? Then you go to the Laguna Police Department. We're right next door to Acoma. Or are they from Acoma? Then you go to Acoma Police Department. Or are they non-tribal at all, right? Neither from the land grant communities or from the tribal communities, in which case then you would go to either state or county. So just an idea of like the complexity of jurisdiction in our communities. And then our communities, we're healing from historical trauma and systemic racism. So within our healthcare system, which are the Indian Health Service, which has been chronically underfunded for decades, we're reeling from forced sterilization from boarding school eras. And so we have like those kind of complexities that our communities are healing from. And we're just 1 or 2 generations out from the deepest impacts of that, right? These are our parents or our grandparents who were raised in these systems. And then I mentioned this, but I think the biggest issue that a lot of us doing any kind of social change work, probably in any BIPOC-led organization, is chronic underfunding. There really are just not enough funds to do the kind of work and build the solutions that we need, because right now in the United States, we have over 570 federally recognized tribes, and that means we're going to need 574 different responses to all of the issues that we're facing as people. So yeah, Thanks, Chris.
Thank you, Angel, for lifting up all of that and then ending with letting us know, hey, again, it's about funding. Felix, I wanted to turn to you, and as you're working to support families, what are some of the biggest challenges you find that are making it harder for you to create better communities?
I think that in the last 3 years, we've all had to navigate COVID, right? And I think particularly in providing support to families who have been, and particularly BIPOC families in DC that have had to navigate COVID here in the city. It's interesting to have a conversation to listen about all the mutual support that we're trying to provide from the informed perspective, from the perspective of lived experience, or the ones with direct connections to the communities we're hoping to serve. I grew up in PG County, but also spent a lot of time in DC. And so PG County is is right next to DC on the east side. And so all this to say that I can see where investments across the city and also across that region, the DMV, I can see how the investments are made and the impacts that it has on communities that either have resources or are stripped from or are not allowed to access resources. And so I think particularly as we're navigating also a new landscape when it comes to the rent spikes across the nation, like people are concerned about not just food anymore, they're concerned about housing, they're concerned about, and not just the families we're trying to provide support to, but the labor force itself is also really struggling to make ends meet. And so something that, just as an example, lately in DC, we've been advocating for home visitors to get pay increases because the home visitors that provide support to families can't live in the city that they're working in. And so that has impacts on, whether a person can even work here or not. But even as, say, like folks are navigating not necessarily a thriving wage, right? You're getting paid not enough to live in the city that you work in. You're also finding that where families might stay connected to a home visitor, and say that home visitor finds a different opportunity at graduate school, right? This is workforce retention is one of the biggest issues that the home visiting environment is currently navigating. And so that there's a lot of interruptions that occurs in the direction of families seeking support. And so when a family is looking to get resources to housing or medical care or daycare, and their home visitor exits, they have to then, fumble through having a new home visitor step in, which again, training a home visitor, a trained professional takes about 3 months to get that person ready to face families at the degrees that we provide support in. And so those interruptions could be a 3-month, or in the case for, we had to pause referrals in our direction because we had gaps for about 9 months. We couldn't provide more support to families because we were directly impacted by not being able to provide a thriving wage because grants don't fund thriving wages. And so, and also, right, I think that where I'm noticing some of the current investments in DC, the mayor of DC is proposing a $750,000 pickleball court, something that's apparently sweeping the nation, but like you make a $750,000 increase investment for a pickleball court, but people are asking for thriving wages, and we're not seeing that reflected in the budget. Oh, I can see where your values are. I can see where you're willing to invest in and where we have to pull teeth in. And so I think that it's a matter of truly the challenges that we're facing is getting elected officials on board with making swift, immediate investments in the direction of communities that are in need. And if I can just pull up the example, East Palestine has had such a faulty response, but we, a couple of weeks ago, bore witness to like a 2 to 3 day business period to like bail out the Silicon Valley Bank. And so if we're looking at, you know, governing systems take months to figure out a plan of action for residents in East Palestine, but within a week have a solution for a different industry, I just, you know, some of these things are, you know, pretty evident. But I think that if we're talking about the challenge, is getting elected officials to make swift investments in the directions of communities in need.
Thank you so much, Felix. And you know, we have Diane and Lupita. I want to hear a bit about your challenges that you're facing. Diane, I can't even imagine what you're going to say right now with the overturn of Roe, but maybe just a little bit about the challenges you're facing. But also, Felix, I just have to say, thanks for that dose of reality and letting us remember, you know, people are putting their money where their values are. So Diane, yeah.
Well, I mean, I think there's a whole set of challenges related to the legislative environment. And this is a set of challenges that are of our own making, not necessarily the present company, but certainly there are folks within, you know, a group that would have considered themselves supportive of abortion rights who have been stigmatizing certain parts of abortion care for decades. I work in later abortion care. I take care of folks who need abortions beyond the point where most clinics can take care of them in the United States. We also see people internationally. People will come to us after having navigated a interlocking web of just stacking restrictions. And we're routinely seeing people who have wanted to get care for 4 or 5 months and have not been able to navigate the restrictions that have been put in place. And I think we all know that these abortion restrictions are not about protecting people's safety. They're not about, you know, helping people make decisions that are best for themselves and their lives. It's about regulating who and when and how people have families. It's about regulating sexual behavior. It's about racism and misogyny. The Venn diagram of anti-abortion activists and white supremacists is basically one circle. And it shows up in a multitude of ways in the, you know, the experiences of the patients that we see every day. So I think one of the big things, and I'll echo everyone who has talked about funding, is helping people get funded for the care that they need. And abortion funds are doing just some of the heaviest lifting, I think, of any nonprofits in the country. They're helping move mountains to get people this essential care. But I think, you know, we as a medical and public health community let abortion get siloed. I think that some of this is a problem that we made. And I think that there weren't enough people 20 and 30 years ago speaking out for abortion as a moral good and as a normal medical procedure, or as a, you know, for self-managed abortion to help communities safely access care outside of the medical establishment. And I think we know now, I think there's a lot more talk about how that's something that you know, people are having to do. But I think, you know, a lot of us see now, I think after a few decades of watching this happen, that people should be able to choose. Like, it isn't just a last resort for folks. And I think we need to have a better system to support people in managing their own abortion safely, which they can largely do with abortion pills. So yeah, I think everything feels like one big challenge, but I don't want to minimize that there have been some incredible successes, and we continue to build a better system than what we had before.
Thank you very much. That made me a little bit more optimistic and hopeful too. Lupita, what are some challenges that you're finding where you're working and really in the important work you're doing there in Florida?
Yes, thank you, Chris. I think when looking at some of the biggest challenges in terms of our organization, in terms of the work that we're doing with the community garden, where we focus on farm workers and on the farm worker community here in Immokalee, has been, especially in the spaces of community redevelopment agency, sort of county meetings. We exist as a unincorporated community, and we've been that way since I was a kid, with no, you know, real investment in the community here. We've just been seen as a labor force and an invisible labor force, you know, and that's going to be, I think, a common theme for me in a lot of answering of these questions and a lot of the discussions that we're having is just this idea of visibility and whose narratives we center and whose stories we center and whose experiences we center, and what does visibility for a group of people say about those that are intending to serve those communities, right? But I think one of the biggest challenges has been that, you know, we have mixed status folks, people that are navigating the immigration system, who have come over, have, you know, been forced to migrate here because of situations and decisions that are beyond their control, because of violence, because of, you know, starvation, because of loss of land. And they come here and they go into this machine that is big ag, where the demand of us consumers is great. You know, we don't think about our Costco size bag of, you know, of carrots or, you know, fruits or vegetables. We just know we want it. And you know, and we don't think about who is actually laboring to put those things together. And what it becomes is in the spaces where we are engaging the county with data about what we're growing and what folks are experiencing. It's just sort of, it's goes in one ear and out the other, because at the end of the day, they're not the constituents that, you know, our commissioner needs, you know, to get reelected, or you know, to keep his you know, his buddies happy. And I think that that's been a real challenge, is to use the community space and the gardening and the stories surrounding foodways and mutual aid that farm workers are doing here in our community, and saying this has value, whether or not it translates into folks that can vote for you, or can that we need to invest in people here, because we need to meet them and build that capacity, but we also need to make the investments here. Now, I go to many meetings where I'll get patted on the back and thanked, and then the conversation just focuses on charity, and, you know, thank goodness you're feeding folks, and that's so great, you know, and it's just very patronizing and condescending, and I think, you know, one of the strongest ways, if I look at things positively, because I can go really angry, and I think I started off in this work when I returned to my community, you know, in 2019, after being gone quite a while. I came in really angry, and I think I came in really triggered. I came back into community as a mother, single mom now, you know, living intergenerationally back in my childhood home, working in social justice again, working in spaces of community garden and outreach. And I was being triggered by a lot of things. I could feel it in my body before I could even find the words to experience, you know, or to say what I was feeling. But, you know, I started going to the community meetings and to the interagency meetings, and, you know, what's going on, who's moving what, and what's been done, and realizing that at my 44 years of age, like, I was still experiencing things that I experienced when I was a kid, and that my parents had been experiencing, you know, like horrible labor conditions, the housing conditions hadn't improved. We still do not have an urgent care. We don't have after hours care. We don't have a hospital. You know, we still have only one grocery store, the same grocery store that has existed here since the 50s. And, you know, with prices for our groceries and our food over almost 21% over the local and national average, you know, failed transportation for most of our pedestrians. And all we can talk about in those spaces is, you know, oh, but we're putting in sidewalks and we're starting to do this. And all I'm seeing is this sort of using poverty as big business, and to get certain grants and to get certain money, but it's not being funneled in the right ways. And so I think, but when I work with people and we cook together and we talk and we use the community garden space to encourage, you know, language and, you know, the original languages of so many Mayan and indigenous folks and our Haitian Creole and Caribbean brothers and sisters, like, that is so powerful to me. And that is where the real change is, right? In reclaiming all of these foodways and reclaiming, the ways that we engage with not just the town, but the environment and the space that we're in, and see the value and visibility within ourselves, so that we can keep going into these spaces and disrupting and calling out and holding people accountable for not making systemic change and not addressing changes that need to be done.
Okay, wow, Lupita. So you answered sort of the question last, but it made my brain ping all over the place. Like, you talked about the culture and how, we need to center it, how so much is invisible. What narratives do we make visible? How do we talk? People just want their Costco sized carrots and they want it now, but they also want it cheap, right? But and people aren't thinking about what are those changes that are happening. And an audience comment said they really appreciate the candor, and it's really telling. And the fact that each of you are just telling it like it is, and they can feel that your impact is real. So with all that's just said and all the different answers that each of you have given on the serious challenges, systemic challenges that you each face in doing this really hard work, I try to stay optimistic. And I know you're doing some great things. Diane said, oh, we're doing this, and Lupita's like, I turned my anger. I was triggered and I had anger, but I'm still there and I'm doing it. So help me right now in National Public Health Week. We're talking about community. That's today's theme. Help me stay positive. Like, what needs to be done to improve the health of your communities, to beat these challenges. How are you doing it? What can I do myself, Chris, at home to stay positive, knowing there are these challenges? What can I do to make their change? What keeps you optimistic and hopeful? And instead of calling on people like that, scary professor, feel free. And any one of you who wants to just go out and shout out and give us, your thoughts. What gives you that joy to keep going? What turns your anger to action, Lupita? Like, what do we do? You don't all have to go at once.
I'll go again, just since I'm sort of, it's in that frame of thought. But I think, again, if I could expand on, what are the hopeful, what are the ways that I feel like keep me coming back and sort of hopeful and positive, is seeing the people power and seeing the power of those intentional spaces of us centering culture and foodways and traditional traditional as central to understanding where we are right now, and that we've repressed those things, and that when we're sharing food recipes or when we're cooking together, that to me translates. Yes, it can translate into certain data, or when I see what folks are requesting more of or what they'd like to see planted in the garden, based on what their diets are and what they've been lacking probably, or what's really expensive in the store and they'd like to see. And we discuss, if this is something that can grow in this climate, is it something that, that we can maybe keep improving the seed, so that as we see seeds growing, that in these South Florida climate conditions, that with increasing heat, that okay, that's the winter, we're going to keep saving the seed. What does saving this seed mean for us? What does this mean for our community? Can we keep growing our seed bank? What would a seed bank look like? But I think that to me is very indicative of this collaborative approach. And when the reason I'm even connected to this panel, this round table, had to do with the Food Policy Council that we got our organization and our staff and our volunteers in our garden got invited to. And I think the first meeting, I didn't realize that we had a representative of Blue Zones there, which is sort of this wellness and health nonprofit that has had some criticism, because it's like, oh, they think everybody needs to be on the Mediterranean diet and they just need a walk and that's going to improve health. And I think the first thing I said was, I was sort of making those criticisms of like, you know, this is really important. I can't believe I'm on this call, but you know, is it another meeting where we just pat ourselves on the back and maybe post a few posters of the what we should be eating, you know, like more kale salad, and then that's it and call it a day, maybe move some vegetables in front of a bodega and say we've improved things. And I didn't realize that the director was, one of the directors for the area was on the call. And it wasn't until later that I saw a different shift in the types of conversations that we were having, and the invite to invite our Guatemalan volunteer and a lot of our mujeres, our women, that, you know, and then I said, I will translate, you know, I want to get them involved. I want us to hear their perspective. And then I got invited to attend a National Public Health summit and like a conference to talk about that building of that relationship and the collaborative effort that we started building within the Food Policy Council, within the interagency meetings. And so I started wearing a lot of different hats, and our community garden members and families and communities started wearing a lot of different hats and being invited into spaces where our voices could be heard, and our stories and sort of our heart could be visible. And I think that sort of collaborative openness is what's going to push us forward. And I think it has to be centered when we're thinking about public health and all of the ways that, like how Leah's work, the intersectionality of it, that translates to me as collaboration.
Thank you so much. And I love that, because you are at the table, you were able to bring others to this literal table to be a part of the discussion and the collaboration. Would any other panelists like to share what keeps them optimistic? You know, what makes what they do possible every day, despite the challenges that they had earlier discussed? Felix.
Yes, thank you. Just to really piggyback off Lupita, I think that I know that hope is a muscle I have to exercise, and that, you know, it's up to me to show up, to be a support to my sisters, to make sure that they have what I can contribute, and so that I can also know where best to apply my labor. And I think that it's a commitment, truly, like from my perspective, a commitment to our shared liberation that really pushes me to be in the space of advocate or collaborator. So I don't want to necessarily put the onus on an external force for me to show up, or for me to feel called to action, because I think I will paraphrase the great Leela Watson. I know how it goes. Like, if you've come here to help me, then you have come here to waste your time. But if you are here because my liberation is entrenched with yours, then let us work together. And I think that I really try to live by Leela Watson's words, and I really try to embody that, you know, I have a short time on this earth, and while I'm here, I hope I get to be of contribution to our well-being. And I think that because I recognize all of these things, it's a muscle I have to exercise, and I don't want to put that on anybody else. And so I think that that's what drives me here. So thank you.
Thank you so much. It was really beautiful. I appreciate it. I feel like sort of this synergy connection happening in the internet cloud, that I'm just like leaving so much more positive about. Would anyone else like to share? You don't have to. I'm not pressuring anyone, but feel free.
Angel? I can jump in. Yeah. So I think for a lot of us in this room, and like, we love our people, right? Like, this really comes back down to the love we have for our people, and believing that the best days for our people are in front of us, that they're coming. And I think that's what keeps so many of us going. So in our work, I believe in cycle breaking. I grew up in a home like the one that we advocate for resources, right? And to have made it through like that kind of a childhood, to make it through relationships where that weren't healthy, that were toxic, that were abusive, and then to come out on this other side and be married to an amazing partner and co-parenting our family, and just like living this life that feels so blessed is like, this is why we do it. I know what it's like to grow up in that home. I know what it's like to be in that relationship, and I know what it's like to come out on the other side. And so I think for me personally, that's what keeps me going. It's just this belief in cycle breaking, the love for my people, and really believing that the best days are coming.
Oh my goodness, I love it. We're starting off National Public Health Week Monday like this. We're ready to break our cycles. We're going to interrupt, and we're going to interrogate and interrupt and lead with love. So Diane or Leah?
Yeah, I'm happy to add in. One of the things that we realized when we were putting this clinic together was that we in the abortion care community had been operating from a scarcity mindset, where it was like, what do we have and what can we do with that, instead of viewing this work from a place of abundance and imagining what it could look like and what we could help, provide for people, and the experience people should have that shouldn't just be good enough, it should be transformative. We have hundreds of years of really terrible medical abuse of all kinds of communities. And it's not enough to just provide good care. It was, we needed to help change the systems that perpetuate that abuse. And so for us, I think that place of abundance mentality, the mindset of what can our imagination do and where can it take us? I think one of the things that the opposition forces have taken from us is our joy and our imagination. And those two things are going to be absolutely essential going forward to be able to sustain ourselves in this work.
Thank you so much. And I appreciate that you said the word joy, which naturally led me back to thinking about Leah. So Leah, maybe if you want to give us what keeps you going.
Absolutely. And yeah, our organization, we came out with a podcast about a year ago called The Joy Report, and decided to shift our focus to maybe 10%, kind of talking about some of the environmental injustices that are plaguing various communities. But then we realized we're talking to the same communities that are impacted by healthcare inequality, education inequality, poverty, on and on and on. We don't want to show up as EJ advocates saying, did you know that systemic racism is even in the air that you breathe and the water that you drink, without providing some sort of, hope and overburdening the same communities. So we decided to shift our programming, and we started hosting climate justice concerts about a year ago. They're called Earth Sessions, and we partner with local environmental justice organizations, bring them in a room together, and we do something called world building, where we do exercises to imagine what we want a better future to look like, and do thought exercises about the tools we would need to be able to make that better future, where clean air and water are rights for all, and kind of infusing that with joy to make sure people have that North Star, what they want the future to look like. So I say that joy is definitely a part of the activism that I do, and can be a part of everyone's activism practice, because this is heavy stuff, and making sure that we find joy is actually a way to resist some of those oppressive systems, by saying that no matter how horrible things get out there, one of the ways that I'm going to show up is to find joy, because I feel like that's a blessing that my ancestors have passed on to me. So I want to carry their legacy, because we didn't even cause this climate crisis, but we'll be here to solve it. So yeah.
Thank you so much. For folks who don't know, as president of APHA, I've been going around the nation telling folks my 3 things of what I want us to start really doing. And they are to play for health, which looks at the joy and making sure people find, a moment of joy, whether it's a walk in nature or, getting together with a friend, doing a puzzle. Weaving. And then, of course, read for health, and then getting to what I know Diane and Felix had also mentioned, which was vote for health, get our elected officials determining whether or not we're going to put some money in pickleball or something else. Now, we only have a couple minutes left of this. So, APHA is all about for science, for action, for health. And our webinar participants are all really incredible. They really appreciate that we're lifting up the ways in which we can stay positive, and they're talking about, there's a whole bunch of chat, about how Indigenous foods, it has so many benefits and then so much other stuff. But I want to leave right now really quickly, maybe each of you on the panel could just take 1 minute. You're doing great work. We heard your bios. You are literally making change in your community. Can you tell us, for those of us who are at home on the call, maybe some of us are at home and we want to be a public health advocate. We want to make change in our community, in our culture, but we're not really sure how. We're a little timid about making change. So if it's okay, each of you give me your 1 minute elevator pitch that will get us off of our chairs and out advocating.
I guess I'll start. I think something that keeps me really optimistic is knowing how many people are actually out there who have been creating solutions to some of the issues that we face, and folks who have been doing this work for decades and decades. So something that made me really optimistic was learning about environmental justice history, and then even just doing a quick Google search, whatever city I'm in, environmental justice organizations in Pittsburgh or St. Louis, etc. And then I read about a 30-year fight that I could be a part of. So I think really getting connected with the orgs in your community, learning about the very special and unique environmental justice community that's right there, will kind of motivate you to do the work, to know that you're not alone, and there's also nothing new under the sun. So you can kind of create an intergenerational coalition of people and join in, and it's never too late to start.
Thank you. Who wants to go next? Give me your 1 minute to get out and make change.
I think for those in public health and want to sort of step into their advocacy is really looking at who's in your circle, who have you surrounded yourself in terms of mentorship, and, who are your colleagues, and how are they stepping into roles of that impact change. And if you find that you have that your circle isn't very diverse and that your circle isn't very engaged, then like Leah said, it's going to be on you to sort of find it. Everything from, it's one of these things that my kids know anytime we travel or we go visit somewhere, that I'm usually going to stop in at a community garden, and because I want to go check it out, but mostly because I want to find friends. I want to find people that are doing, that have seen the things that I've seen, that have had conversations like I have, and maybe that I'm going to learn something new from. And I think that that's where it starts. It really is a responsibility for those of us that want to step into these roles to do the healing work and the work, the deeper work of asking ourselves, why is this important to me? And how do I see my life embody sort of this need or this want for change,
Thank you, Lupita. Diane, Angel, Felix.
I can go. So I think leaning into discomfort is a really important thing. This work is really hard. You learn things about yourself and about your own history and about stuff that you can't go back and change, but that going forward, you can be part of reshaping. So I think being okay with being uncomfortable, knowing that that's where the growth happens, I think is really important. Just like Leah said, there's nothing new under the sun. So don't reinvent the wheel. Someone has the same passion you do. Someone is doing this work. And I would encourage people to align themselves with the groups that are centering the people who have been the most historically marginalized, because that is where the work is happening. And those are the needs that we need to be centering and doing the work.
Thank you.
I can jump next. Yeah. So I'll just share really quickly that this isn't the work I was planning on going into and spending my life doing, right? I worked in a corporate setting and I started volunteering at the Coalition to Stop Violence Against Native Women, and that's how I started. And then office coordinator position became available and I applied for it and I got it. It was the scariest decision of my life, was to leave all of the security that I had to go into nonprofit work. And 8 years later, I'm still here and have grown this. So, I think the scariest decisions for ourselves sometimes are the most beautiful. And so take that chance, take that risk. Your ancestors are always with you, protecting you. And so jump in, do it, get involved. And then particularly if there's any Indigenous folks in the audience watching, I would say go home, right? Like our communities need you to be at home because there's so many issues that our community leaders are addressing, and ask for help, be willing to be guided. It's one of the reasons that we're home now is it was time for us to come home and be a part of community again. And there's a place for you and you belong there. So, thank you.
Thank you. Oh no, Felix, we're running out of time. So you get 30 seconds, but you can do it, I think, as you work with all these families and kids.
I think that the biggest thing that I've taken away is just to listen. The families that have come to me for seeking support in any way, shape, or form are the ones that have actually the answers. And it's just figuring out how I can use my time and resources to meet their answers. And so listen, if you can, use your resources in the direction of those seeking, and I'll get there.
Thank you so much, Felix. Listen, he says. I can't thank you all enough for letting me be a part of this panel. I don't know if you could feel it through the cloud, but I could. I learned a lot. This is the first day of National Public Health Week. It was all about community and culture, and I learned a lot. I hope you did. And one thing I want to say is, and I want to lift up what Lupita said, find your friends. And if anyone is looking for a place to do some good work with other like-minded individuals, join us at APHA, right? APHA.org. We're a membership organization. I found my family of advocates there to work alongside with. But still, thank you so much. I want to turn it over to Dr. Susan Poland. And thank you so much to each of our literally rock star esteemed panelists doing the good work, making change. Thank you.
Thank you, Chris. And let me add my thanks to all the speakers for such a rich, engaging, and inspiring conversation. Chris is absolutely right. You're all rock stars. And I learned so much from you today. So thank you for your time. Just a reminder that this webinar was recorded and will be made available at the end of the week. Check out the other National Public Health Week events and resources at www.nphw.org. And participants of today's event will receive information about other upcoming events at APHA. I want to give a quick shout out to the APHA staff who put this and all the events of National Public Health Week together. We couldn't do this without you. And it's going to be a really full and exciting week. So thank you so much to the audience for joining us live today. And I hope to see you at some of the other National Public Health Week events.